means is an acronym for Focused Aspiration of Scar Tissue. And anytime, so basically it came about with sports medicine, overuse of the shoulder, overuse of the elbow. Everybody may or may not have had a bout of tennis elbow at one time. Not that you played tennis, but you might have overdone it and had some elbow pain. And that's where the focus started. So once we got some successful results from that, we started training on other parts of the body. So basically, where the tendon so where the just for education points, a ligament connects bone to bone, and a tendon connects bone to bone, but it's through the muscle. So, and it's usually across a joint, and it provides their mobility. So the focus of this procedure is where the tendon meets the bone. And you may or not have heard the term tendonitis, maybe once or twice. But basically, the tendon is what moves our joint. It connects, and that's where the tear is. The tear is where the tendon meets the bone, and when it tears, we bleed a little bit, and we develop some scar tissue, and then the next time you do whatever you're doing to tear it the first time, it aggravates it and aggravates it. And you stop doing that, and sometimes it goes away, sometimes you ice it down, sometimes you take an anti-inflammatory, Advil, leave, something like that. And so the next time you're out doing your activities, is there any way we can blow all that up?
That's as big as it gets.
Okay.
Yeah.
Then, all right. Then can you make it slide down a little bit? So basically, now that we know what a tendon is, what causes tendon pain? The trauma, whether you got hit once or repetitive trauma, you got hit a lot of times, and that's usually more of overuse overuse or not exercising or over-exercising. You haven't built up your stamina yet, and you can damage the tissue that way. So, we go to the next page, please. So what this, now that you know what a tendon is and how you get a damaged tendon, the treatment options we talked about, rest, medication, anti-inflammatory, sometimes the injection of the steroid I just alluded to earlier. A little bit further down. A little therapy, whether you do it yourself or have go to B's House of Pain. It gets done, and it can be very effective. But just a little story: when I was in training in Detroit area, our radiologist was an avid golfer, and so every new crop of orthopedic surgeons coming through, he always described his tennis elbow or golfer's elbow in his situation, and he had that for 5 years. But so just to let you know, sometimes it went away, sometimes it didn't. If it got real bad, he'd have one of us inject it. So I was thinking of him when we were training about this. So these little tendonitis can go for a long time because that scar tissue does build up, and you just add to that. So how is this procedure any different? Well, after you've tried most of the other procedures, there's the open procedure where we go and we take that scar tissue out. That was our last choice of treating this. There are some other things that we're trying to do, like we'll take your blood, spin it down, and get the essence of your platelet-rich plasma, inject in there, and have your body come in and try to not fix, but it was more or less reconnect that damaged tissue. But It hasn't passed muster just yet. It's still out there. We still do it, but we don't have the results like we do if we just go in and take it out. Now, what this FAST procedure does, next page please, is basically it takes a small needle, and you can take the needle and it's connected to a suction device and some saline. But more important, as we direct it, it's through an ultrasound. So we find that damaged tissue, which we can see on ultrasound, and we stick this needle, and at the very tip of it is a oscillating tip with a suction device. And so we find the damaged scar tissue. We know where we're at through the ultrasound, and we turn the ultrasonic
vacuum.
Yes, ultrasonic vacuum. Very good. So basically, it disrupts the scar tissue and it sucks it out at the same time. And also, what's different is that the recovery time is what's advantage to this procedure. It's usually done. It's mostly done under local. It has to be in the hospital because that's usually where the equipment is. It hasn't got to the price point where we can have it in our offices. But basically, it's in the hospital. The incision to get the needle or ultrasonic tip in is just a stab incision. So it's not really a stitch. It's more of a steri strip, a butterfly, if you will. And so after the procedure's done, it's done under local. Afterwards, you're able to go home. You're able to drive yourself since you didn't get any IV anesthetic. And so for the first 2 weeks, what happens whenever you take anything out of the body tries to discard it in again. It's just how we function. So you need to go in and take the scar out and have it just reform. So what this does is as you're doing your self-directed therapy or where you go to therapy in town, then what we're trying to do is as those new fibers start to reform, they're more in alignment with each other instead of discombobulated from the original tear. So we do heal by scarring, but it's more in a uniform pattern. And next slide, please. Or next page, please. And that was it. Wasn't that fast?
Yeah.
Almost as fast as a fast procedure.
Okay.